Hello, good evening. It's Dr. Trudy Ufundu of Snowspirations Global Health Solutions. I apologize for coming in a little bit late. I actually broadcasted in the wrong channel. But this evening in our channel, we're going to talk about the reason. I'm going to give you 5 reasons why you have to at least allow 18 months before becoming pregnant when you've had a baby. So this evening, we're going to look at the reason, the major medically backed evidence-based reason where you have to allow a gap of at least 18 months before becoming pregnant, not giving birth to your baby, before. And the reason is because pregnancy is a very delicate process. It's not just enough to put all your energy towards becoming pregnant. You have to take good care of yourself, your body, your mind, your spirit. Every singular thing about you as a mother needs to be fully taken care of. So there are evidence which shows that when you don't do this, when you quickly become pregnant, when you've had a baby, if you don't allow 18 months gap, there are a couple of medical implications that can affect you, affect your baby, and on the long run, you might be at a very big disadvantage. So we're going to talk about the 5 points, and I'm going to start. Number 1, when your baby it's not up to 18 months and you quickly become pregnant again, the possibility you will not carry your baby up to 37 weeks is very high. Now, generally, for you to have a healthy baby, your baby is supposed to at least get to 37 weeks. 37 weeks is called term. A baby that is born from 37 weeks up to 42 weeks, it's actually a good to go baby. So when you have your baby, we can assess the baby and you can go back home. But when you don't allow the 18 months gap to have your baby, you will have an increase in the possibility of having your baby before 37 weeks. That means you will have an increase in possibility of having what we call preterm labor. So any labor that starts before 37 weeks, it's called preterm labor. So a woman that will have preterm labor will over time have a preterm baby. The problem with having a preterm baby is because their organs are not fully developed. So most preterm babies will stay in the hospital, in a place we call NICU. They will stay there on a long-term basis until we are sure the babies are doing okay before we can send them home. So if you want to avoid having a baby earlier than 37 weeks, please plan towards giving yourself 18 months. 18 months is equivalent to a year and 6 months. So if you're currently a new mother, in order to make sure we are careful, please allow 18 months. That's number 1. Number 2, when you also don't allow 18 months to elapse before you become pregnant, you are likely going to have a baby that will be low birth weight, and also a baby that will have what we call small for gestational age baby. So in small for gestational age baby, there are 2 important dates you have to know as a pregnant woman: your expected date of delivery and your GA, gestational age. So assuming you're going for 20th week ultrasound, normally around 20 weeks, we go for an anomaly scan. When we check that baby at that 20th week, if you didn't give enough gap, your baby will look smaller than expected. That's small for gestational age baby. And those babies that will be small for gestational age baby will likely be delivered with low birth weight. So babies that are born below 5 pounds are termed low birth weight. Babies that have low birth weight will likely not have fully functional immune system. So they might be prone to developing infection. They might be prone to having problems. Some of them might have GI problems. Some of them might have cardiac problems. Some of them might have a couple of other problems, including brain problems. So the first point is to avoid preterm delivery. The second point is to avoid babies that will be born as low birth weight or small for gestational age baby. Now, the third point is also in line with what happens to the womb. You see, when you deliver your baby, as a woman, there are so many things that has happened in your body. You've lost a lot of blood. You've lost a lot of nutrients. You've lost a lot of things that normally should nourish your body. One of the things you've lost on big level is iron, and you need iron to make blood. Now, when you have shortage of iron, you will develop iron deficiency anemia. So if you don't allow 18 months gap, when you eventually become pregnant with that baby, you might likely develop anemia in pregnancy. And anemia in pregnancy can complicate your pregnancy. You can have complications like, babies not developing properly, having your baby early, having low birth weight. And unfortunately, in some situations, some babies can die. So avoiding anemia in pregnancy will warrant you to do what? To avoid having your baby as soon as possible. Make sure you observe the 18 months gap to avoid developing maternal iron deficiency anemia. The third point, which you have to mention, is the likelihood of putting a lot of pressure in your womb. Your womb takes a lot of blow during pregnancy, contractions. So many people will have assisted delivery. You probably might have had myomectomy in the past, cystectomy, or you probably might have had so many procedures in your womb, and we might have induced labor or augmented labor. Now, when we do that, we put a lot of pressure on the womb. Now, when you don't allow your womb to heal properly, you might likely develop womb rupture, or what we call uterine rupture, which is a deadly emergency that can kill you. So when your womb is not well rested, there are a couple of other risk factors that can predispose you to having womb rupture. If you have multiple pregnancy, if you have previous surgeries, if you were given pitocin, which is a drug we can use to induce labor, then you have put a lot of pressure on the womb. So when you don't have that 18 months gap, you are likely going to lead to womb rupture, which is deadly. When your womb ruptures, your baby is not going to survive, and likelihood you will not survive, depending on the hospital facilities where you live, is very high. Now, the final point, which will make you to slow down in regards to trying your mental health. So when you deliver a baby newly, you need to develop a lot of strength. You need to recover, and your mental health is very important. So you need to take care of your body. You need to take care of your spirit. You need to take care of your mind. You need to get all the support you need. Now, if you are not fully rested, if you are not fully recovered from previous pregnancy, which will recommend 18 months. If you become pregnant quickly, you might be prone to developing postpartum depression, postpartum psychosis, maternal blues, all the problems that can aggravate your ongoing pregnancy. So these 5 points should be the major reason why you should allow at least 18 months. Now, there are some exceptions. Top on the list is the age of the woman. So if we have a woman who thankfully delivered a baby, and we've noticed that her ovarian reserve is low, we are not going to wait for 18 months. We are going to look for things we can do to prevent a couple of things. Then we are going to encourage her to have a baby, because when your ovarian reserve is low, if you blink, you're going to go into menopause. So if women are above 35, and if we check their indices, their health conditions, if they are doing okay, body weight-wise, exercise, lifestyle, we are not going to wait for 18 months, because if we wait for 18 months, they might likely not have an opportunity to have their own baby naturally. So we have to give them some waiver. But by default, once you are 35 years and above, you are classified as what? Advanced in maternal age, and is a risk factor. So if you're gonna become pregnant quickly, we are gonna keep a close eye on you and monitor that pregnancy and make sure that the pregnancy is developing okay. So remember to prevent preterm labor, to prevent preterm birth, to prevent having a baby with low birth weight, to prevent having a baby with small for gestational age, to prevent having womb rupture, to prevent having anemia, and also to prevent developing mental health problems. Please allow 18 months to elapse before becoming pregnant. Very important. If you can do this, you will give yourself a better chance of having a healthy baby. So spacing your family, it's more important to quickly having your babies. Make sure you take care of each member of the family so that everybody will develop optimally. So remember the 5 points: avoidance of preterm labor, preterm delivery, low birth weight, small for gestational age baby, uterine rupture, maternal iron deficiency anemia, and your mental health. Now, some other women can also develop placental problems. So we don't want any of this. We want the woman to be happy. We want the baby to be happy. We want the husband to be happy. We want the siblings to be happy. So please, in as much as you might likely not understand this, if you are in the category of women that are above 35, we can work with you. We can check your ovarian result. We can keep an eye on your health, and we can package you to make sure you become pregnant, and we keep an eye on you and you don't have complications. Okay, so I'm going to allow us to ask our questions now. So please go ahead and ask your questions. Do you advise contraception while waiting for 18 months, especially for believing for baby couple? Yes. If you have good ovarian egg reserve and you know you can comfortably do the 18 months, right? Yes, we will advise you to go for contraceptives. Now, when you are using contraceptives, there are about 13 different methods. The lesser the hormonal-based contraceptives you will use, the better. Unfortunately, long-acting contraceptives might likely require you to use hormone-based contraceptives. But please be meticulous. Discuss with your doctor. Find what will work for you within that 18 months gap, especially if you're younger than 35. Because if you're younger than 35, you can easily become pregnant naturally. So it's important you work on your contraception if you and your partner are gonna be having regular lovemaking within that 18 months. If you don't do that, you can easily become pregnant, especially if you are younger. We've had cases of women that recently had a baby. They were waiting for their period to come back and they became pregnant. So waiting for your period to come back should not be the criteria for you to avoid pregnancy. Once you make love with your partner without protection and you are younger, you are likely going to become pregnant. We've had cases of women that had 3 months old baby and they became pregnant again. When you do that, you're putting your life and the life of your baby in danger. It's generally not recommended. Okay? It's 18 months spacing applicable to a woman that gave birth through CS. Matter of fact, CS is a double risk factor because by default, you should allow the CS wound to heal properly. So if you actually delivered your baby through CS, is actually an added risk factor. So a woman that had a baby through CS should, by default, make sure firmly that 18 months has passed. The reason is because your womb is already captured with. If you had your baby through the vagina, we didn't cut your womb. But if we had your baby through CS, we've actually had an incision in your womb, so we weakened your womb. So if you quickly become pregnant before the 18 months, you are likely going to have complications. So yes, women that had their babies through CS, women that had previous surgical history. So if you've had myomectomy, myomectomy is the surgical removal of fibroid. Fibroid and bringing out a baby are pretty much the same. The only difference is when we go for CS, we are bringing out a baby. When we go for myomectomy, we are bringing out fibroid. So if you have been operated on in your womb, please allow your womb to heal at least 18 months before you go again. How long should a woman stop using hormone-based contraception before beginning to try? Now, this is an area you need to be very careful because some contraceptives are long-acting. And when you stop using some contraceptives, you actually have a period of infertility. So this is an area you can come in, we evaluate your chances, we see the one that will work for you. We have 13 different methods. So some women can actually be told to stop using their contraceptives about 6 months before the period they will get to that 18 months. So let me give you an example. You recently had a baby, right? And you're on course to apply the 18 months, right? And you're below 35. When you are using a contraceptive, we will give you a contraceptive that will give you a period of about 6 months before the expiration of the 18 months. The reason is because for some women, When they stop using their contraceptives, their fertility is not going to bounce back immediately. There are some women that will require 2 months, 3 months, even 5 months before their fertility will come back to normal. Some contraceptives will disrupt your cycle, make it irregular. We can't predict it more. So because when you stop using contraceptives, your body will struggle to normalize. So we normally advise you to work with your doctor. We'll find a convenient contraceptive for you. Using condom and using all those withdrawal methods will not work. The worst form of contraceptive to use, if you genuinely want to apply the 18 months, is withdrawal method. So long as you have contact between the penis and the vagina, you can become pregnant. So you have to see your doctor so we can meticulously give you a reliable contraceptives up to about 6 months before you want to become pregnant. So we don't want to cause infertility when we are trying to avoid spacing. This is the thinking between making sure that a woman that is above 35 with low ovarian reserve, we try as much as possible to help her to become pregnant as soon as possible. Okay? What can one do to help get help right amount of time between pregnancies? What can one do to get help the right amount of time? I'm kind of trying to figure out your question, Ebenezer. Can you rephrase it again? Okay, let me take care of the other one. Then you can ask that one again. How can having less than 18 months baby between pregnancies affect the next baby's health? Remember that the life of the baby is in the hand of the mother. So if a mother had iron deficiency anemia, if a mother developed depression, if a mother developed mental health problems, if a mother developed other complications based on the previous ones, the index baby is going to have problems. So the index baby is likely going to be born early. The index baby is likely going to be low birth weight. The index baby is likely going to be malnourished because the mother needs to be in good health to avoid complications. So let's take, for example, if she has iron deficiency anemia, if we don't correct that iron deficiency anemia, what's going to happen to the second baby? The baby is going to be malnourished because the baby will not get enough oxygen to function properly. So the effect of your lack of waiting for 18 months will be manifest in your own health, which will be manifest in the second baby. So what we are actually trying to do is to make sure that the mother is healthy so that when she eventually becomes pregnant, she is healthy. Your pregnancy is not something that happens overnight. You actually begin to plan for pregnancy even way ahead on time before you become pregnant. This is why we preach prenatal care. So if you want to be a mother, from day one, you need to start living healthy because what you put in your body can control your body weight can control your health can control the health of your baby. Let me give you an example. If your body weight is above 30, and you want to be a mother, it's already a risk factor. So we want you to bring it below 30 so that you can give yourself a good chance. Okay, so it's important we apply the 18 months gap. The only restrictions, the only exceptions are women that are above 35, and probably for some reason, we discover that they have poor ovarian reserve. If you have that situation, then we might likely work with you gently and make sure you're pregnant and make sure we monitor you. So by default, once you get to 35, you are classified as advanced in maternal age and is a risk factor, and we have to keep an eye on you and make sure that your baby is good to go. What can a woman do to help her get the right amount of time between pregnancy? By imbibing this knowledge, by knowing. When you know and you practice what you know, you're in a better position, right? So first of all, dealing with your reality, knowing the reason why you have to wait. So you see, when you know, you can change your attitude. When you change your attitude, you can change your practices. When you change your practices, you can change your perception. So the key word is knowledge. Now, while you are waiting, take care of the baby you already have. Live healthy. Avoid your alcohol. Take your prenatal multivitamins. Avoid stress. Get a lot of sleep, drink a lot of water, exercise, make sure your body weight is within normal. Before you blink, everything is happening so fast. Before you know it, it's 18 months, then you begin to try. Remember that the 18 months is not to have a baby. 18 months is to start trying. So the spacing is from the time you had the baby up to 18 months before you start trying, not having the baby. So a year and 6 months must elapse if we want to have a good outcome. Okay? Do we have any other question? If we have any other question, please feel free to ask. It's important we understand this, because if you understand this, then you're careful, you plan all your pregnancies. If you want to have 4 babies, that means you're going to have approximately 2 years gap. Okay, 2 years is 24 months. So if you're young, then you can space your babies to 2 years gap. The more well-spaced your babies are, the more you give them a chance to even know each other. When your babies are closely knit together, some of them might have some disadvantages, which you might not really know. And at the end of the day, it's going to take a toll on the woman. For some reasons, women are the people that bear the big brunt of the family. So space them out. Allow the 18 months to pass. Make sure you understand the rationale. Now, it's better you are not pregnant. There are some women that will become pregnant within this period and they will want to go to remove the baby. Please, let me just give you the best advice. If you are not able to do the right things, and you and your partner continue to make love and you ended up becoming pregnant, please don't abort that baby. You might not have a chance to have another baby in the future. We do not encourage anybody to abort their babies, because lately having pregnancy positive test, it's so difficult. So if you are not able to be disciplined, to work with your doctor, to use reliable contraceptives, and you ended up becoming pregnant, please still work with the same doctor to make sure we do our best to make sure you have good outcome. Don't think of removing the baby. We've had couples that previously, maybe they were not prepared and they removed the baby. Now, the mind is a terrible tool. When you abort your baby by your own decision, and subsequently, if you begin to have difficulties having a baby, you begin to blame yourself. You do not ever want to live in regret. So if you eventually become pregnant and you didn't plan it, keep the baby. Don't go removing the baby. It's not the best decision. We've had women that came back, oh, doc, I did this, I wasn't ready, I'm blaming myself. When you blame yourself, you're putting yourself in a very tight corner. So once you're pregnant, just make sure you work with a doctor. Then we do our best to see what we can do for you to deliver your baby. Do not abort your baby any which way, okay? All right. Okay, I'm coming. Okay, please, doc, what's the best prenatal multivitamin? This lady, I remember you've been asking this question, and it's still the same thing I will tell you, madam. They are all called prenatal multivitamins. Now, depending on where you live, if you're in Nigeria, the popular one there is Pregnacare. Pregnacare. What you should be looking out for in your prenatal multivitamin is the quantity of folic acid. So make sure they are up to 400 micrograms of folic acid. So it's not just the name, it's the quality, it's the content. Make sure they are not expired. Make sure it's from a good pharmaceutical shop. I don't care about the name. If you're in America or developed countries, there are thousands of prenatal multivitamin. But if you're in Nigeria, go and check for Pregnacare. Pregnacare. Besides the folic acid, you will also have what we call omega-3 fatty acids, vitamin D, and other important multivitamins. So it's multi. So everything you're not getting from your food, you are expected to get them from the multivitamins. So depending on where you're living, if you're living in Nigeria, go for Pregnacare. Pregnacare is actually available globally. So if you're living outside Nigeria, you can go to Amazon or any of the online shops, or you can walk into any of the pharmaceuticals, go to their over-the-counter. The beautiful thing is multivitamin is over-the-counter. So you go to the over-the-counter, you buy it, you start using it. 3 months before the period you're anticipating to be pregnant, then 3 months into your pregnancy. Let me repeat again. 3 months ahead on time when you are anticipating you will become pregnant. Then 3 months into that pregnancy. Now, because nobody knows exactly when they will become pregnant, what I normally preach is, if you are making love without protection, start taking your prenatal multivitamins. Because some women will be pregnant, they won't even know they are pregnant, and before you blink, you've already passed first trimester. The most important period your baby needs your multivitamin, it's actually the first 3 months, within the first trimester. So if you miss the first trimester, you've actually missed a lot. So start taking your prenatal multivitamin from the period you're meeting with your partner, and you know fully well that if you eventually become pregnant, you're going to have your baby. Okay? All right, thank you so much. If we have any other question, I'm free to answer them. But if not, thank you for coming. Please remember to click on the notification. Remember to subscribe. Share this video with your friends, especially your partners. So I know so many men want to have all the babies in the world, but please consider your woman. Your woman needs to be in good health. A healthy woman having a baby will have a healthy baby. So have family conversation. Understand the need, why you have to wait for the 18 months. When you understand we want to avoid preterm delivery, we want to avoid babies with low birth weight, we want to avoid babies that will have small for gestational age, we want to avoid womb rupture, we want to avoid placenta problems, we want to avoid possibility of having mental health problems and anemia. So if you understand the reason, then you will work towards having a good family, okay? Thank you so much for coming. In the absence of any other question, tune in again on Saturday. The Saturday clinics will come a little bit early. So by 5 p.m. Nigerian time, 12 p.m. Eastern time US, but my Tuesdays YouTube clinic comes about 7 p.m. That's about the best time of coming live. Now, there are so many other important videos in this channel. We virtually covered all the important channels. Remember, the reason why we show up is to educate you, to help you to understand your body better, to make better decisions, so that at the end of the day, you're not just going to have your baby, you're going to have a healthy baby, the mother is going to be healthy, the father is going to be healthy, the siblings are going to be healthy, and the whole family will be complete. Now, remember that at the end of this month, on the 30th, on Sunday, we have a special event, the workshop for Believing for Baby category and ANC women. It's going to be a combination of workshop, things you have to be conversant with, things you need to do so you will be in the league of mothers. And if you're already pregnant, things you have to make sure you don't ignore in your pregnancy so you have a good outcome. It's not just enough to be pregnant. We want you to be pregnant and have a healthy pregnancy and have a healthy baby. Okay, so thank you so much for coming this evening. I appreciate you guys, and I'll see you guys on Saturday. Once again, I apologize for coming in a little bit late. Hopefully, it won't happen again. Thank you, and enjoy the rest of your evening. Bye-bye for now.